You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Dr. Lavine, Los Angeles, California. How are you?
I'm doing well. Thank you. How about yourself?
Pretty good. Thanks for coming over.
Thank you for having me.
Why digital dentist? How did you make that transition?
It wasn't supposed to be what it is. I'll be honest about that. I was a full-time practicing periodontist for 10 years. I found out pretty early on that I didn't love it. When I was growing up, my family owned the largest electronic distributorship in Canada. So I grew up with tech. This was like in the early to mid 90s. So when I set up my practice, I had done my own networking, started adding my own technology as we went around, and realized that most of the offices that I work with weren't really computer savvy. They weren't incorporating some of the newer technologies that were coming out in dentistry at the time, digital x-rays and cameras, things like that. I had a knack for getting all that stuff to work together. So I started helping out my referring offices, and it became so busy that I said, I really don't love being a periodontist. I love the tech stuff. What should I do long term? And right around 2001, I had heard that California was passing licensure by credential. Typically, at least in dentistry, you have to take different licensing exams in different regions or states. I would never be able to pass the California boards as a periodontist because I hadn't done a denture or a filling in 12 years. But because California had a shortage of dentists in the desert areas, they foolishly thought that we're going to open up the doors to dentists from all over the country. We're sure they're all going to go to the desert versus LA, San Diego, and San Francisco, which is exactly where they went. But there was a short window there, so I thought, you know what? I'll give up my practice in Vermont. I'll come out here to LA. I've gone to college here. I will practice 3 or 4 days a week. I'll do my IT consulting a day a week. Maybe in 5-10 years, I can switch the ratio. They didn't mention the 15,000 people on the waiting list. So I got here thinking I could practice right away. It was over a year. Which in retrospect was the best thing that could have happened because it really motivates you to get off your behind when you have no income. So started doing what I'm doing now. It took off. And by the time I could get my license a year later, I was like, well, I didn't like it the first time around. Why do I want to go back and do periodontics the second time? I already had a couple of employees. I was lecturing. I was traveling. I was enjoying what I was doing. So this became my full-time career. And that's what I've been doing for the last 23 years.
That's a great story of success. So what exactly are you doing then?
So I work in the healthcare industry, mostly with dental because of the fact that I was a periodontist. We do work with a number of physicians' offices, chiropractors, plus affiliated business associates of practitioners, so attorneys, accountants, practice management consultants, basically IT, cybersecurity, and HIPAA compliance for the healthcare field. So everything from computers and networking to ransomware protection, HIPAA compliance, risk assessments, backup and disaster recovery, patching, you name it. Anything that's tech related, that's within the realm of the services that we offer.
I think it's a great combination you got in this field because you come with this experience of being a dentist and you know exactly what it needs to work properly.
Yeah, it's the key of my success, to be honest with you.
That's what I'm guessing. It's something that you relate to really easy. And I have to tell you, there's some horror stories out there in the field, in your field.
We see it every day.
People that have no clue what healthcare means, and they have just their little niche of doing what they're doing, and it's a nightmare. The customer service sucks. It's not working.
We see it every day. And I mean, you're right. First off, even though having the DMD after my name has nothing to do with my tech skills, I have instant credibility when I walk in the door because I walk the walk, I talk the talk. I'm a colleague, and I understand the needs of a practitioner, the small spaces, the need that you can't have systems down. That downtime has to be measured in minutes, not hours or days. But even in my field, like for example, as an IT provider, we offer HIPAA risk assessments because you have to have an IT background to do a proper risk assessment because you're evaluating the computers, the network, the firewall, the encryption, the user accounts, the shares, everything. There are so few managed service providers, which is what I am, IT providers, that do risk assessments. And it's like trying to treat a patient and present a treatment plan without diagnosing first. It's just impossible. It's always a surprise to me. Why aren't more managed service providers, IT providers offering these risk assessments to their clients because as you know, it basically generates income as an IT company. Of course, we're going to find things that need to be done. So it's almost a no-brainer, but for some reason, people aren't doing it. So it's hard.
For somebody who is not necessarily savvy with computers, and I'm sure dentists are one of those categories of medical practitioners that are very good at what they're doing, but I'm not sure they rely too much on the computer world for their practice. What would be your advice for an office right now?
Besides hiring me?
Obviously, to maximize their protection, because I think the main risk here, what we're talking about, is stealing information, stealing databases, get into patients' accounts, get private information, and all this stuff. What's the best way to protect?
So we typically, when we're working with a practice, we take a three-pronged approach to helping them. Number one is making sure they have the infrastructure in place first. You have to have modern computers. For example, many of your listeners are probably aware that Microsoft Windows 10, which is still very much the predominant operating system out there, is going end of life in October. They will no longer be providing security patches for that operating system. Other than email, which is the number one way that ransomware gets into a system, an unpatched operating system is the most common way that ransomware can enter the system. So you have to have the infrastructure in place to be able to make sure you can do what you need to do. The second approach that we take is we need to do everything within reason to prevent these malwares from getting into the system. That means having a business class firewall, not the one that's built into your cable modem, not the one that you use at your house, for example, but a really good one. A lot of times they'll have an anti-malware subscription that you pay for yearly. So to have that in place, you need to have obviously antivirus software, anti-ransomware software. Windows has a built-in program called Defender. It's mediocre at best. And it doesn't cost a lot to have a really good antivirus program in place. About $30-40 a computer a year is kind of the going rate for decent programs. The problem with firewalls, antivirus, anti-ransomware software is that the newer viruses that are now coming out are what we call zero-day. And there's a lot of ways to define zero-day. It basically means that it is a virus that exploits a vulnerability that we didn't know existed beforehand. So your antivirus software, your firewall, doesn't know that it's a virus. It doesn't know what to do with it, and there's a good chance it can get through. So there is a class of software that we've been recommending for most of our clients over the last 5 years called application whitelisting. The best analogy I can give you of how that software works. Let's say that you heard there's a private party in your city and a lot of movie stars are going to be there and it's close to your house, and you figure you're going to crash that party. And you show up at the door and there's a very large bouncer with a very small list of names. Basically, you ain't getting in. That's what application whitelisting does. We create a database of all the approved programs that are allowed to run on the network. If anything gets on there that's not on that list, it's stopped in its tracks. It can't run. And in the 4 or 5 years that we've been applying this for our clients, we have yet to see a single practice get hit with ransomware, which is not something I could have said previously.
Interesting.
But even though we have all these systems in place, the fact is nothing is foolproof. And we have to have some type of recovery. So obviously a really good, tested, HIPAA compliant, encrypted backup and disaster recovery system that we can measure the downtime in minutes, get the practice up and running quickly. We also are highly recommending that practices have some type of cyber liability insurance, a minimum $250,000. Because if you get hit with ransomware, by definition, according to HIPAA, that's considered a breach. And unlike a lot of HIPAA, which is somewhat ambiguous, the breach notification rule is very clear that if you're hit, you have to have your practice listed on what they call the wall of shame. It's not a place you want to be. Notify the local media, but most critically, contact all your patients in writing and notify them of the breach, which I think is just devastating to a practice. Yeah. So we really want to make sure you never have to go through that.
For a novice, it's been an all of the time type of question. What's best, a Windows-based computer or a Mac type of computer?
Well, so the equation is changing a lot recently because a lot of the software systems now are moving towards cloud-based. Most of the the better-known medical practice and in dentistry as well, we're seeing that now, a move towards cloud-based. The challenge with that is that even though most of your data is in that practice management program, that EMR, that EHR, whatever, not all of it is. every practice that we work with, there's other places where patient data resides. Now, HIPAA has identified, I use that as a pun, 18 identifiers. There are 18 different criteria that if the data contains this criteria is considered protected health information. Patient name, date of birth, a phone number, an address, a chart ID, a photo, anything that would allow a third party to be able to identify who that is considered protected health information. It has to be backed up. It has to be encrypted. You have to treat it as the important data that it is. So, and all practices have that. It might be emails, it might be Word documents or spreadsheets or QuickBooks or, something. They have that information on their system. So even if you have a cloud-based system, you're not out of the woods. Mac systems are inherently more secure than Windows-based. The challenge that we see, especially in dentistry, not so much as much in the medical field, is that there's such a small number of systems that work with Mac. Digital x-rays, for example, there might be 40, 50 different digital sensors that we use in dentistry. Only one or two work with Macs. Now, you can run Windows on a Mac. You can use VMware or Parallels or Boot Camp or whatever, but then you've just defeated the whole purpose of the Mac, if you're going to be running Windows on it. So yes, in a perfect world, I love Macs. I love the Apple ecosystem. It just is going to tend to limit your choices when it comes to software. And a lot of the systems that we use for security don't natively work on Mac systems.
Okay, so now we got into, we evolved in the past 25 years, I would say. We evolved from, getting the internet-based computers and kind of society, right, to an AI future.
Correct.
What do you think is going to happen? Because I can not, I would say, rule out the fact that AI is not only a good thing, it could be a bad thing too. And
I'm very scared of AI.
Yeah, and I'm thinking, what can happen if, some minds out there use AI to create some kind of viruses that can, seep into those protection systems?
I'm sure they already are. Maybe we don't hear about them as much, but they absolutely are. Like you said, AI it's a double-edged sword. There's no doubt that we're seeing it in healthcare, both on the diagnostic side, on the clinical side of treatment, as well as administratively. We see there's a number of systems out there that handle things like answering the phones and scheduling patients. And, it's eliminating, of course, the people who work for us, our support teams, our admin teams aren't happy about it because they're losing their jobs. That's kind of what AI did. That Microsoft just came out yesterday with a list, and I don't have it in front of me, of the top 25 careers or jobs that are going to be eliminated by AI. So we are definitely seeing a move towards that. But I'm seeing that what we're seeing now is AI for video production that looks real. It's just incredible what can be done. And as someone in the IT field, I'd like to feel that I have a pretty good ability to be able to tell if something's AI or not AI. I'm getting stumped with some of them. It is really challenging, and you just don't know if they can do it for video. You don't know if you're talking to a real person. You don't know. It could be a friend of yours. I mean, it is so good, and I don't know what we do about it because I don't know how you regulate it. I don't know, what we can do from a governmental standpoint.
To regulate something, you need to know the limits. I don't think we know the limits now.
I think that it's unlimited. With the explosion that we've seen just in the last couple of years with ChatGPT and all the other systems that are out there are beyond.
Yeah, and they're investing so much, money and billions of dollars in extending this network. And I can only imagine it's not going to stop anytime soon.
I kind of wish I held on to my NVIDIA stock that I had about 10, 15 years ago. It would be worth a lot. I'd probably be retiring right now. But it's, like I said, I wish I could say I think this is where it's going to go. I share your concerns. Like I said, I love some of the things that AI can do. I think it's fantastic with some of the things that we can do. It helps me a lot in my career. When I'm putting together a marketing plan for my business, when I'm working with clients, where, like I said, we're seeing people that are, offices that they can't really afford to have additional personnel in there, but the AI can handle it and reduce their expenses. A lot of people in dentistry or people outside of dentistry don't know that in the dental field, we have massive overhead. A well-run dental practice is running at about 60 to 65% overhead, and that's well run. Most of them are probably closer to 70, 75% overhead. So I used to annoy the crap out of me when my patients would see my treatment plan and say, "Oh, this must be funding your new car or funding your kid's college," even though I didn't have a kid then. But they don't realize that we have a lot of expenses. So I do see the benefits, but very, very concerned about where this is headed.
Yeah. Now, also, in this field, to be successful, you probably went through some things that not too many people see. What's the worst thing that you encountered?
We see it all. I think the problem that we see with a lot of healthcare providers, especially the smaller solo practices or small group practices, their approach is, well, this can't happen to me. Why would I be worried? Yes, it can happen to a large hospital group, or it can a large insurance provider, something like that. And those are the ones you hear about in the news. You hear about Anthem getting hit, or you hear about large hospital groups. You don't hear about the small ones. But I would encourage people, next time you're at your computer, Google HIPAA wall of shame, and you go on there. There are thousands and thousands and thousands of practices that are listed on there that have been hit. The biggest mistake that I made, and this is, I confess up to the ones that we made, is that we do backup and disaster recovery for almost all of our clients. And the way that our system used to work is that we need an initial backup. We would send a hard drive to the client. We would copy it onto there. They would send it back to us. We would upload it to the cloud where our cloud backups went. But we would also start doing daily, what we call incremental backups, any new files or files that have changed. So we had no system in place for actually knowing if the client had ever sent that drive back to the data center. They all did, so we just assumed it was working. And a number of years ago, there was a major fire in a town here in California called Paradise. The whole town was leveled. We had a client out there. He'd been with us for about 3 years, and he called us up and he said, "Listen, my practice burned down. I need to be able to contact my patients. Do we have the backup?" I said, "Yep, we've been backing you up for 3 years. I see all the incrementals." We go to restore it, and we realized we didn't have that initial seed backup. The very first backup that we take that was supposed to be on the hard drive was still in his office. Well, now it was charcoal or whatever was left of it. We had no way to restore that office. We lost decades worth of data. It changed how we do our backup. It changed how we interacted the systems. But it was just a real wake-up call that we have to be really on top of this, because for most practices, losing their data would just be, it's devastating. All the insurance in the world is not going to help. If you can't contact your patients, it's just not going to help you. So we've seen that. We've seen offices that were hit with ransomware that, we had told them what they need to do. They ignored our advice. And with ransomware, it's not so much that you can recover. You can restore a backup. If it's done properly, you can restore a backup in 10, 15 minutes. That's the easy part. The problem is you need to remove the virus. And a lot of times you don't know where it is and where it may be running lying dormant, where it entered into the system. That takes days. So for a lot of practices, that's also something. That's why we're so invested in making sure that they protect themselves and do everything to prevent it from happening, because you're looking at oftentimes an entire week of downtime where you just can't function until we know that we've gotten everything out of their system. So we've seen it all. We've seen everything you could possibly imagine. But as I said, as an IT company, we're constantly evolving. The things that I would recommend to an office today, if I went back 2 years to what I recommended, probably 80% of what I recommended is no longer something that we recommend, because there's someone built a better mousetrap, or we found something that was easier for the client to understand or easier for us to maintain. We're not trying to be the most complicated solution. We want our clients to have a basic understanding. We provide the support to them, but life is always a lot easier if they can do some basic troubleshooting on their own. And they say, "Oh yeah, I remember Lorne's group. They told us what to do when this happens," and they can resolve it in 2 or 3 minutes on their own versus an hour of our time to try to figure it out.
Yeah, it's interesting because most of the practices are limited to their patient care, right? They don't have, I would say, the education, the knowledge, and the experience to run a system like this. And nowadays, if you don't have an IT company that takes care of your backup data and your back office and all this stuff, you're done. You can't function.
Yeah, I would say. I was going to correct one thing that you said.
Yeah, I would say your expertise probably is the most important in a practice.
Well, we like to think so.
As fast as you can work with a patient database, as fast as you can contact patients, as fast as you can get the claims out and all this stuff. I mean, this is what the engine of the practice is. You can only see one patient at a time, but you have to have this whole network in your pocket, basically.
And the challenge with that is that, just sort of following up on one thing you said, a lot of practitioners think they know that they can handle the IT because they do stuff at home, or they do stuff for friends or whatever, and they think they can handle it, or they have their spouse's cousin's best friend come in to help them out. Healthcare is just a different animal. There's just so much. When we work with an office, we try to get them as HIPAA compliant as possible. We tell them from the get-go, we're not getting you 100% compliant. There's 700 pages of rules and regulations. It's impossible. We know, having had practices, clients of ours that have gone through HIPAA audits, that there's a core thing of about 10 to 12 things that they're looking for. That if you have that in place, you're going to be in fairly decent shape. But the local mom and pop shop IT people, they just don't know. And it's not something, unfortunately, you just can't just read a little short primer on it and say, oh, okay, now I know. It takes really years. And I'm not trying to be self-serving when I say that. We're, of course, we are thrilled to work with any new clients. But if you're looking around, really try to find someone that has worked either exclusively in healthcare or really has a good understanding of cybersecurity and HIPAA. It is critical. And like you said, it's if your IT systems are down, you're down for the most part. You cannot schedule, you cannot pull up data, you cannot submit insurance. You're literally dead in the water. So that's why we work the way that we work with practices, is that uptime is really important.
What do you think it's coming? 2025, 2026. What do you expect?
Yeah, I think I see some bad stuff coming, to be honest with you, when it comes to ransomware, AI. I think we sort of gone through every like 4 or 5 years, we seem to go through these phases. We had a really significant uptick in ransomware right at the beginning of COVID, because a lot of people were out of their practices and they still had their computers running because they wanted to have remote access, to be able to pull a patient data. They were not protected at all. So we saw a significant uptick with ransomware. We're just seeing, it's like a game of whack-a-mole. Every time we come up with a new way to combat it, they come up with a new way to do it. And I agree with you that AI, if it's not already, will be what they're using to develop these ransomware viruses that are really difficult to beat. It's like a regular human virus that is resistant to all known antibiotics out there. So as far as the future, I think we're moving obviously more towards cloud-based for everything. I think that's kind of where the industry is going. I have my concerns. I think it's great for group practices, multi-location practices. It's with the costs associated. We still, for most of our single location practices, we're still recommending that they have a server, that they have regular workstations. It's just easier for us to manage and maintain. So I wish I had a crystal ball, because that would help me with my career if I could start offering services or start doing webinars or lectures on where the future is. But it just changes so rapidly. Like I said, stuff that I was using a year or two ago, not even on my radar anymore. We've tossed it aside. So it's exciting, but it's scary.
With what experience you have right now and what knowledge you have, if you look back when you started this whole enterprise, what kind of advice would you give to yourself?
I'm not sure. Well, first off, I wouldn't move cross country without knowing that I've got practice waiting for me, or that I can do what I thought I could do. Because I had a couple of lean years, I'll be honest about that. That was not the smartest move. I really should have done a little more research. When you're done, you're done. And I was out, had 1 foot out the door, and I wish I had done it a little bit differently. I don't know if that would change that much, because the thing is, with my industry, every 4 or 5 years, there's a paradigm shift. My first 4 or 5 years, I was focused exclusively more on just nuts and bolts IT, putting together networks and computers and monitors and digital x-rays and cameras and cone beam and 3D imaging and CAD CAM and digital impressions, all that type of stuff. And then HIPAA really became, even though HIPAA was actually been around since '96, it wasn't until about 2009 with the HITECH Act, with the need to secure electronic data, that became a thing. And we really focused on HIPAA for a number of years. And what we found is that, for whatever reason, HIPAA wasn't moving the needle. I think a lot of practitioners just kind of put their head in the sand or figured, we're at low risk. What's the worst that could happen? And then once ransomware became a thing about 7, 8 years ago, that's where our focus is. We think AI is really kind of the next big horizon. Beyond that, I don't know. Like I said, I wish I could predict the future. Other than that first year or two where I was, eating a lot of cereal, I don't know if I would do things a lot differently. I love what I do. I love working with healthcare providers. I wake up every day excited. I got a team of 5 or 6 other people that are with me. They do a lot of the heavy lifting. I get to do the things that I love doing, webinars and educating. And I traveled all over the world lecturing. I write for a lot of journals. I love being on the forefront of doing that. And my days are, my whole reason for doing what I'm doing is to have balance. For the first 7, 8 years of my career, I think I was just focused on income generation and income preservation. My son was born and life changed. And, for the first couple of years, it wasn't as bad with my son, but then I was missing parent-teacher conferences and soccer games. And I was like, no, I'm not that father. I want to be involved. And I said, I need to have balance. I need to be able to have a business model that allows my business, unlike when I was a periodontist, if I'm not chairside, I'm not producing. With my business, I've got my team. And, the focus for most IT providers now is recurring revenue because the services we do have monthly. So my role has become more of a sales and marketing role, educational role, and I got my team to handle the day-to-day. So I can take time during the day to go to one of my son's graduation, or I can do stuff with my family, or I can decide to take 2 or 3 hours for lunch, or go out and hit a tennis ball or whatever, and still have a productive day. So that's what I was focused on, and I am perfectly happy where I'm at. I'm 63. I've got tons of energy. I see at least another 10, 12 years of this because it doesn't tax me the way it did for the first 5 years of my, and certainly in my practice, it taxed me. And the first 5 years of this business was pretty challenging, but I'm where I want to be, so no regrets.
So how can people reach out to you, know more about what you're doing?
Sure. So the easiest is my website, which is thedigital.dentist.com. As I said, we work with a lot of non-dental healthcare, so you don't need to be a dentist. Dental, I think, is actually probably the most challenging because we have so many systems, unique proprietary systems, unlike the medical field where a lot of it's integrated. You have got a lot of Twain integration. You've got a DICOM for imaging, and we don't have as much of that in dentistry. There's a contact us form on there. We have a toll-free number, 866-204-3398. Extension 200 would get you to Candace, my office manager. I never charge for my time to consult. So if someone wants to call me up and say, hey, I'm interested in finding out more about what you do. The other thing we don't charge for is initial evaluations. We'll log into a client's network, take inventory of what they've got, ask them some questions, and put together a treatment plan without any obligation, without any charge. We're happy to let you know where you're at. You don't have to work with us. Of course, we would love it, but you'll have the information to go out and do whatever you think is right. And those are probably the two easiest ways. I have email. I've got, I'm online. If you look me up, The Digital Dentist, on Twitter, Facebook, Instagram, LinkedIn, I'm on all of those, but the website's usually the easiest.
That's awesome. I certainly want people to reach out to you because I think, there are very few people that can combine what you do. And your experience in healthcare is very important. Thank you so much for coming.
Thank you very much for having me. It was a pleasure.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.